Good afternoon. I got your attention. Hello, hello. Thank you all for joining us at this wonderful last discussion of this incredible conference. It's really an honor for us to be able to close such an incredible array of conversations about health and equity, young people's health, mental health, physical health, and the ways to improve all of these things as we work together. This panel is entitled Resilience, Adversity, and Young People's Health. We have a very dynamic group of 4 presenters and 3 discussants, and I'm going to introduce myself, and without further ado, Alexis Cullen, my co-chair, and I will get us started. I'm Lisa Richardson. I'm the Director of Research and Evaluation at the Institute for Women and Ethnic Studies, a collaborator and a member of the Heron International Network. And we're very happy to be here and contribute what we have to offer to this very dynamic conversation on health and equity and the needs of young people.
Hi. As you said, I'm a consultant nurse and I work in the National Specialist Forensic Mental Health, Adolescent Mental Health Service at the Maudsley. And this was my doctoral study, so I'm going to present. And I looked at the mental health needs of young people involved in street gangs. And the reason I did that was because I was lead clinician in Lambeth CAMS, and we had a major incident where a young person was stabbed, and it hit the papers, hit the news, and we had a serious case review, and I was part of the investigation team, and we knew all the alleged perpetrators, we knew the victim, we knew the perpetrator's siblings, we knew the victim's siblings, all in the service, but gang violence wasn't mentioned in any of their records. So I thought it'd be quite interesting to find out why. First of all, I was thinking, why is it that we're not talking about this and not documenting it in our clinical records? Does it have relevance to our clinical work at all? And what does it mean? Does it have any relevance? And when I talked to people, they either didn't want to talk about it, gangs didn't exist, this was about 7 years ago, or they just came up with lots of questions about what do we mean by gangs. So I decided I would have a look at it. So I'm going to whiz through some of these because it's quite short. But what do I mean by gangs? There are lots of things that people talk about when it comes to gangs. People talk about the riots that happened in 2011. So I went to some schools and they said, oh, you can't do our research here. We don't have gangs because we're mainly a white population. There aren't many black people here, or we're all girls, or they don't wear colours. I got one GP practice saying to me, we have a terrible problem with gangs in our area down in Kent because we have a group of 4 15-year-olds that hang around on street corners until 9 o'clock drinking cider. I was fortunate enough to win a scholarship, and I travelled to LA and Miami to look at some of the gangs work over there, and I met people like this, and some people think about men like him when they're thinking about gangs, and then others think about the young people that have been the victim of knife crime in the UK. I think what I mean, and Professor Jeremy Coy's just published a paper around gangs, and he's talking about the adult population, and I think he's talking about something very different from my research, because he asked them, are you a gang member? And the research shows that if you ask someone if they're a gang member, that's a very different population to the population I studied. They're more the sort of serious organised crime. They come together in order to commit a crime. I'm talking about young people who hang out on the street corners, who hang out together in public, who are friends, close friends, have grown up together and happen to offend together. And that's part of their identity as a group. So I'm a member of Eurogang, who are a group of academics across Europe and America who are studying gangs within America and the UK and seeing if they're comparable. So there's a lot more research in America in the area. And they use this definition: any durable street-orientated youth group whose involvement in illegal activity is part of the group identity. And then I use the SDQ to think about mental health diagnosis. So when I went to the literature, there really was not very much, and virtually nothing in the UK at the time. There were some studies in public health, one around MAOA, and other studies in the criminology, anthropology and sociology field. And the public health talked about drinking and drug use, early sexualised behaviour, non-accidental injury, acting in daring and courageous ways, aggression, and one paper said a higher risk of suicide, but there's no reference to suicide or a measure around suicide prior to that. And that's one around MAOA. And then I think what I found in the literature was that despite lots of the literature talking about mental health problems, none of them primarily looked at mental health problems, and a lot of them actually meant emotional distress or stress rather than mental health diagnoses. And also it didn't differentiate much from offender. All the information they got around gang members was extrapolated from the offender population and didn't take into account that these people had these close networks of friends that they considered their family, that could be a protective factor, or the fact that being part of this group could exert a sort of a cohesive, unifying effect on them and protect against mental health problems. So my research question was, is there a difference between the mental health of those involved in gangs and by definition offending, those not involved in gangs but offending, and then neither offending nor in gangs? And then I had secondary questions around if there's a difference between those in custody and those in the community, and is there a difference in the type and frequency of offending according to their mental health problems. It's a cross-sectional study using, it was meant to be an online survey, but I had a few problems with that, with the IT in the schools and prisons not allowing things. It took me a year to go through ethics. Researching children, offenders, gangs and mental health seemed to blow up all their concerns. I used the Eurogang Youth Survey, which is a very long survey, and I used their core questions plus a few others that use a filtering technique to define if someone's a gang member, so asking them questions that relate to the operational definition. And then there is a question around whether or not you think you are a gang member, but that doesn't determine whether you're a gang member. 2 inner city schools and 1 young offenders institute, and all years 7 to 11, so 11 to 16-year-old pupils, and all the prisoners, and they were given prize draws and tokens of appreciation in prison because they weren't allowed money. So I had 506 returned, 465 included in the analysis. The population, as you'd expect in the YOI and the school, were far too dissimilar to be able to analyse together. And I had some significant challenges to adherence to the research protocol, in that the schools decided actually they only had a problem with year 9 and 10, so they'll only ask year 9 and 10. And then the other school said, well, we just used we just asked the tutor groups who we had problems with. And it was too late in the school year to go back. So as a result, whereas you'd expect about 4 to 6% of young people in an inner city borough school to be in a gang, I had 16% in my school, I had more offenders in the sample than I did non-offenders, which I think is completely misrepresentative of the sample in the school. But that being said, it did come up with some interesting findings. And some of them were to do with the victim of crime, and also about knowing if you've got gangs in your neighbourhood. But primarily, and also their offending behaviour. So gang members were far more likely to offend and frequently offend than non-gang members. And frequent was more than 6 or more times in 1 year, and serious was one where it could lead to a custodial sentence if you were charged. And it was an anonymous survey that asked them about their offending behaviour. So that my findings, the summary of I'm only going to present the significant findings, and the main ones were around inattention and hyperactivity. The SDQ, for those of you that are not familiar with it, it gives an indication of psychopathology, and it could be that the inattention and hyperactivity is related to trauma, or it could be that it's related to ADHD, because I didn't get a developmental history, I didn't get any history because I had to keep it. The ethics wouldn't let me ask any open questions at all. But gang members had significantly higher levels of inattention and hyperactivity than non-gang members and in the general population, and the significance increased for boys. And pro-social difficulties, gang members had significantly higher levels of difficulties than non-gang members, and the general population. And emotional difficulties, gang members had more than the general population, but not more than the non-gang offenders. And in total, gang members have more than the general population. The study also found that there was no difference in frequency or type of offending for any of the mental health domains apart from inattention and hyperactivity, where those that scored highly for inattention and hyperactivity were more likely to score borderline or abnormal, which are the clinical categories in the SDQ, than others. So implications for the research. More studies, preferably funded to me to do with my team. And although it tells us about inattention activity, it's a complicated relationship and we need to know more. I came up with a model for a preliminary conceptual model for gang involvement that I'm not able to go through now. At the moment, the studies being, I think for us, it's what do we know as a result? And I think we're developing some interventions at the moment and trialling some interventions, but also the research is being replicated at the moment in Sao Paulo. They've just finished their data collection and it's going to be replicated again in central Mexico to see if there are any international comparisons. Thank you, and thank you to all these people.